Now tuned in to the tap in. We talking again. Yeah. Welcome to the podcast. Might talk a little shit, get a little brash. Might drink a little bit, smoke a little bit. Vibe a little bit, laugh a little bit. Yeah. Hosted by Fidel. Tell it like it is, only tell it real. Live every Tuesday, you know the deal. We talking again. You now tuned in to the tap in. You now tuned in to the tap in. You now tuned in to the tap in. We talking again. Come on.
What's up, everybody? This is Fidel Jr. We are here talking again podcast once again, doing the video conferencing because, hey, that's what we're doing now. It's in the pandemic season, right? It's funny that I've been calling this a season. It's not funny, but it is. It's weird that I've been calling pandemic season. Do you guys find that weird at all or no?
I wish it was a season.
I wish this was a freaking scary movie that never happened 2020.
Yeah.
It's crazy. So let me introduce you guys. Irma Garcia on, I guess, top right of me or whatever. Irma Garcia, there she is. And down below we have here Lorraine O'Campo.
Hello.
Both nurses, ICU nurses, correct?
Mm-hmm.
Yes.
Okay. And both of you have worked in the COVID-19 department area? Is that what you're calling it?
Yeah, we call it the COVID ICU. Yeah, we have. Mm-hmm.
So
Lorraine has a little bit more experience in that unit because I actually moved out of the ICU. So I was there at the very beginning of it, and then I left at the end of May. And that's where it kind of took off. But Lorraine has been there pretty much since day one, and she's still there.
Still there.
Mm-hmm. Yes.
Oh, that's interesting. They don't have you guys in shifts? Or is it you've just been in there since day one and you haven't shifted out of there?
Actually, the way it works is my hospital has 4 ICUs now. We have without getting into too many details and having to explain it all, but there's a MICU, which is a medical ICU, a surgical ICU, which is where me and Irma come from, a burn unit, which is an ICU, and then we just opened up a cardiovascular ICU unit. So the MICU, the medical ICU, is the unit that has been designated the COVID unit. And so that's where we keep all of our COVID ICU patients. And so what we're doing so that those ICU nurses don't get burnt out is we're rotating the other ICU nurses through in shifts to kind of help ease the burden and like the emotional stress, the physical stress of having to deal with COVID every day. So it helps that we're all carrying the burden equally.
When you say that you guys are rotating from ICU departments, that means you got people from surgical also working the med, was it?
Mm-hmm.
Yeah.
The medical ICU.
Medical
yes.
ICU, MIC, right? Okay. So
MIC, yeah.
Prior to COVID and the pandemic, what was MIC for? Like, what was it designated for?
So the MICU was it's a medical ICU, so it's people who come in for medical emergencies. So like they aren't controlling their blood sugar and they need to be on an insulin drip, or their blood pressures are really high and they can't be on the normal units, the normal floors for that. So they need to be on some sort of IV drip to control their blood pressure, or they have a stroke. Unfortunately, not unfortunately, because it's actually a good thing, but for us, the ICUs are all kind of mixed and matched. It's kind of like wherever there's a bed available is where that patient goes. So we get everything. Like you'll have one neuro patient and you'll have one trauma patient, or you'll have one DKA, one medical ICU patient, and you'll have a trauma or a neuro. So at County, we get this experience that is so valuable because you see everything, we deal with everything. We're not just one specialty, we're everything. Yeah. So it's nice.
Go ahead, Irma.
I'll just say, so like just because I worked in the surgical ICU, that doesn't mean that I didn't get experience with any other ICUs. We saw everything.
Same thing, rotation. You guys rotated out?
No,
or?
we stay in our units, but the patients, if there's a room empty, that's where we place you in one of the units that has an open bed.
Yeah.
Mm-hmm.
I'm sorry, I don't mean to make light of this, but it looks like Irma has a propeller on her head. One of those propellers.
Oh, I'm sorry.
No, I mean, it is what it is. It is what it is. I just thought I'd point it out that it wasn't a propeller hat; it was her fan, her ceiling fan. Okay, there's a reason why it's called intensive ICU. It's intensive care. Yeah. So I mean, before all this, you guys were seeing some crazy shit, anyways, right? Surgical, and maybe not so much. I mean, this would be a question for you guys. Which unit was the worst, like as far as emergencies that you guys would see most traffic?
I wouldn't say any particular unit. I mean, we saw everything equally, I would say. Okay. Except for, I mean, now it's a little bit different.
Well, so that's what I was leading to is it so during this whole pandemic, is this the craziest that you've ever experienced, both of you?
Yes and no. So we've always had very sick patients. We get them maybe one or two where they're very, very sick. And there's like regular ICU patients. And then there's like, on top of that, there's like those very critical ICU patients. We would have maybe one, maybe two at a time. Now we have a unit full of how many, Lorraine?
16.
16. That critical, that I've never seen. Of course, we have, every year we have the flu season. We have one or two that are very sick. But to have a whole entire unit dedicated just for critical COVID patients, never.
Yeah. Have you? And so is like what we see in the media. Obviously, we're not. When I say we, as in civilians that aren't working at hospitals, we don't see what's going on in the hospitals. They actually don't want you to come in. A lot of us have to call in now and get our, tell you symptoms over the phone, and then give you a prescription. So we don't get to see what's going on in the hospitals. Is it what we see in the media 24/7, or is that just? It is 100%. That's what we see. It's people in and out, or in and out after 2 weeks or whatever. 14 days, right? Is that what does it vary?
These COVID patients are sticking around for a long time, right, Lorraine?
Yeah. So in our ICU, I mean, in a perfect world, yes, they would get COVID and in 14 days they would be better, right? But that's not what we are experiencing in the hospital that I work at. A lot of these patients come in with comorbidities that they aren't even aware that they had. So they are usually obese or a little overweight, and they have undiagnosed diabetes, hypertension that are taxing their body already, just baseline. And then you throw on top of that a COVID infection, and their bodies are now pushed past the point of reserve, and they could land in the ICU, and they're having to be put on these machines that give them a lot of oxygen, a lot of support. And the goal is to keep them off the ventilators. We do everything possible to do that. Give them the treatments. We support them with non-invasive airway management. And then as they get sicker, the last thing we want is to intubate them. And then once they're intubated, it gets a little more complicated. And it taxing. These patients get really sick, and they're on the life support machine. They're on multiple medications to keep them alive. Oftentimes, they're requiring 2 nurses as opposed to 1, or the normal 1 nurse to 2 patients. Now they're requiring either 1-to-1 nurse or 2 nurses. So they're getting beyond what we are used to seeing as far as like sickness level wise. Mm-hmm. And so that's where we're at. We have patients that have been in the hospital for over a month now in the ICU because we can't wean them off of the high oxygen levels that they're on. And it's sad because they're alone. They're not allowed to have their families there. Oftentimes they can't even talk on the phone because they're so tired. They're in so much respiratory distress they can't speak. That speaking wins them, So it's sad. It's sad. They're in there for a long time.
Are some of you having to not only care to them physically, but now have to somehow emotionally care for them too because of them not being so distant from their family, not being able to talk to them?
Of course, that's nursing though. It's not just you came in and you're sick and we're going to put a Band-Aid on your problem. Yeah, I mean, we are the patient advocate. So whatever that patient needs, you're homeless and you need help finding somewhere to stay that night because you're getting discharged. Guess what we do? We consult the social worker and make sure you get taken care of. Like, it's beyond just fixing them. We're there for them. We hold their hand. We get them up and walk them to the bathroom. We feed them. We bathe them. Mm-hmm. It's more than just taking care of them in the medical sense. It's emotional and all those things. Sometimes it's spiritual as well. If they want someone to just hold their hand while they pray.
Yeah.
It's everything.
Yeah. Have you guys noticed, obviously it's a respiratory issue. That's one of the main factors here with COVID, from what I understand. Is there anything preventative for some people like us that are now that don't have it? What kind of things that we can do? Obviously, build up your immune system is one, right? The key thing. Anything else? Like, is there certain foods I should be eating? Like, I've been eating garlic cloves. I've been either chewing them or I throw them in my teas. Why? I don't know. I heard Joe Rogan do it, and I'm like, tastes like shit. I've been doing that. I haven't got sick, but I mean, is there anything like that? Is there a secret potion?
I don't think there's any research out there. They're still trying to figure out why some people get so sick and other people have no symptoms.
Yeah. Like asymptomatic people that aren't.
Yeah. That they test positive, yet they have no symptoms. Or there's these perfectly healthy 20, 30-year-olds that are dying.
Yeah.
And that is real. I've seen it happen. It's not being made up. There are very healthy young people, and we don't know why some people have the reaction that they do, where they end up losing their lives, and some people just have no symptoms whatsoever.
So it's not due to them having like a previous sickness or sort of heart problem or heart failures, anything prior to contracting COVID? There's nothing to do with that?
I think if you already come down with the COVID and you have these issues, then they can play a big factor in, just maybe getting worse and sick. But I've seen the news where you have these like 90-something-year-old people that survive COVID. What is it about their bodies that they're able to fight it off, and you have other people who aren't?
Yeah. So not enough studies to kind of factor in that reason, right?
Yeah, and I think that's the scary part for any of us. We don't know, who is going to have these severe symptoms and who's not going to have it.
Yeah. Mm-hmm. Now, do you guys know anyone personally that has had the disease?
Yeah, at work.
Yeah, some
other healthcare.
Yeah.
Mm-hmm. Yeah.
And how have they dealt with it? Was it easier for them being in the field to get treated or fight it faster?
The one particular individual that I am familiar with, she was fortunate enough to just stay at home and not need medical attention. So in that sense, I guess, she was very lucky.
Yeah.
But, just from talking to her, she was telling me how just being sick, she was describing how it felt like, and it sounded miserable. It didn't sound like anything, just like your regular common flu or cold where you're like sick for a couple of days. just how they describe it. It's, she was weak, in a lot of pain, muscle pain, and just the list of all the symptoms. I think she had most of them.
Yeah. And so after testing positive, what are some of the things that we should know to do? Again, after testing positive, what are some of the steps that we should take going forward after that? For the safety of yourself and others around you.
Self-quarantine.
Yes. Pretty much stay home and not be around any people. I mean, nowadays we have the luxury of, if you're sick, I know we need to go get food. You have people you can rely on to like bring you food. There's Instacart. There's like no reason why you should be out and about,
right,
potentially spreading this to other people. And then number 2 would be, contact the people that you were in within the last week that you were in contact with, and let them know, hey, I tested positive, and just to let them know. And that way they can be out on the lookout for any symptoms and possibly even get tested.
Yeah, it kind of reminds me, I know you guys are way too young for this. I mean, I'm probably too young for it. But the AIDS, when AIDS was around, when that happened, I think it was mid-'80s.
Yeah.
Yeah, that was same thing. Like, people, contact everybody you've been in contact with, let them know, that's some of the things that you should be doing, right?
Yeah.
It kind of reminds me of that, where it was new. Everybody's afraid. They're scared of it right now. Well, they're afraid because we don't know what this is, right? It's like all the other ones, because this is a SARS thing. We had the SARS that I think was maybe 14 years ago, or was it less than that? That had like some pandemic, a SARS pandemic. But same thing.
I don't know exactly, but yeah.
Go ahead. I'm sorry.
No, I was just saying, I'm not sure exactly the year, but yeah.
Same thing. It's like we don't really know what it is, and everybody's freaking out right now. Not to get too much into politics, but people are freaking out that is this a conspiracy theory? Is this an agenda? I myself think politics, or just in general, people are opportunists, right? We seek out situations and crisis and see how we can benefit from it. A lot of people right now, it seems like, where I think you're either on this side, you're on that side. You believe it, you don't believe it, or you think it's just all made up, wearing a mask, trying to control us. How much does that play an issue into the spread of COVID, if any?
I think pretty much all I'm going to say about that is it's just a mask. It's just a mask. Yeah. It's not that big of a deal. If it's something, the way I see it, it's something that small. Wearing a mask is gonna, let's say I'm positive for coronavirus. Hypothetical, I'm not that I know of, but let's say I am. I put a mask on. I stop it from spreading. That's a good thing. I would feel like, as a human being, as a nurse as well, I would feel horrible if I knew that I passed it on to somebody else and that ended up costing them their lives. Like that, it's just like being a human being. It's as simple as that. Just wear a mask. That's it. It's not that big of a deal. And that's pretty much it. Wearing a mask is not political. People are making it political, but it's not. It's a public health crisis. What's going on right now, and like you said, people are, taking that opportunity to make it something else, and that's the way I feel. I don't know. Do you have any thoughts, Farine?
Yeah, I agree with Irma 100%. There's been so much talk about it. People want to say it infringes on their rights. Yeah. Ask to wear a mask. But it's more than that. It's caring about other people. So, it's a simple little mask. It's not going to hurt you. You can take it off right when you walk outside of the store or wherever you are and you're out in the open in fresh air. But it's bigger than just, I think people are just really selfish when they want to pull that card. It's bigger than them. And I really wish that I could invite them onto the COVID unit so they could see, what me and Irma deal with. And then maybe they would care a little more. But People don't. And it's sad. It's heartbreaking, but it's just humanity, I guess.
Is that, yeah, it is. And it's really sad. But would that be an unethical thing, or maybe even against the law with like HIPAA rights and stuff, to have some kind of a webcam, right? So that's just.
No, 100%.
Cannot do that.
It would definitely, like, we would lose our jobs. Yeah. But I meant like hypothetically.
Right.
You know, people don't believe it until it affects them directly.
Right.
And so, I never want to say, man, I hope one of your family members get coronavirus, because that would be horrible. You never wish what I see at work on anyone, ever. But that's the only way that they're going to understand what we go through and what these families go through and what these patients go through and how they're dying alone in hospital beds. I wouldn't wish that on anyone.
Yeah.
It's sad.
And like I was telling Irma, the main reason why we're doing the Zoom, or doing the video conferencing and not here in my studio, my nice, wonderful studio here, is because for the stop of spreading it, and then kind of a common sense thing. So it's very important, and a lot of people don't think that. They think that, it's never going to hit me. But until it does, then it's like, this shit is real serious, Mm-hmm. So not to say that I never thought it was serious. I would think that they're blowing it out of proportion, and I may still have a little bit of thought, but it's because I look at YouTube. I watch YouTube way too much, and they're feeding me all this junk. So a lot of it makes sense, But then at the same time, hey, I do have someone really close to me that tested positive, and I had to do my part. Wear my mask. I always wear my mask. I mean, for me, it's easy. That's another thing. Gator sleeves, mask, N95, doesn't matter what kind of mask I wear.
The N95s are used. They're usually for the healthcare workers. That's what Lorraine would use in the ICU. The N95s, you have to get. So for them to do their job, you have to get fitted. And so that's for healthcare workers, pretty much.
Yeah.
Yeah. So for us outside, you can wear the simple mask that they sell at Costco now.
Right.
Or I know they've the news, or not the news, but there've been like videos of like the difference between all the different masks. So I know there's some that offer more protection than the other ones. But at the end of the day, if it blocks, some of the particles coming out, then it serves, a purpose.
I think
how much
better of a purpose than not being covered, right?
Yeah. I mean, if you're coughing up a storm, stay home.
To share a small experience that happened to me just like that today was we were at a car dealership, and that's where I work, right? Or different car dealerships. I walked into the car dealership. All of us are wearing our masks. This lady walks in, an employee there, sneezing 4-5 times, sneezing. Everybody stops in the showroom and just stares at the lady. So someone yelled, "Go home."
Yeah.
You know what I mean? Middle of the day, it's like, go fucking home, man. You should never have came to work if you're sick, And I know it's hard for some people to stay at home and they just want to fight it out. But I think the times of us trying to tough it out is just, and this goes for employers too. Like, fuck, let those people go to stay home. You know what I mean? And I know it sucks if people take advantage of it and say they'll call in and say they're sick, just to get the day off. But
yeah,
it's these times are scary. You know what I mean? You guys know more than us how scary these times are. So, one of the things I wanted to touch on too was the procedures that you guys go through in a day-to-day at the hospital. Have they changed since COVID, and how much or how drastic have they changed since COVID as far as just day-to-day procedures?
Yeah. So we're supposed to do like a self-screen before we arrive to work. We check our temperature and answer some questions like if we've experienced a new cough or had any of the symptoms or been diagnosed before we get to work. Also, depending on where you work that day, if you're in COVID, you have to change into the hospital supplies OR scrubs, or like an extra set of scrubs for you to wear. So, and then you wear like the booties to cover your shoes, and you wear, a lot of us purchase like scrub caps. So we put those on. And And then at the end of your shift, you go and you change into your regular scrubs, or some people just wear like workout clothes, and then you go home. Mm-hmm. So that's changed.
Now, is there a self-screening that you do on your way out, or does that matter at all?
No, actually, there isn't. Okay. It's just when you get to work.
Right.
It's a daily one.
Yeah. Mm-hmm. Okay. So is that, do you guys see that as like a damper in your schedule, where something extra that you have to do, and or is that just part of work that, hey, it is what it is, and we're doing this for the safety of others?
It's pretty much a new normal now.
Yeah.
The new normal. I hate that.
Yeah.
I hate that. But it's true, right? The new normal.
Yeah.
Yeah. Is there anything that you guys want to leave behind and let everybody know? I know we kind of crossed on most of it, but anything that you guys personally want to leave behind, a message out there? This is going to air next week on Tuesday. But anything that you guys would like to say before I move on to the next topic?
I would say take it serious. Mm-hmm. The media is not hyping it up. At least for San Bernardino County, it's I think we might have hit our peak. It seems like our cases in the hospital are starting to slowly out on the decline. Slightly. Doesn't mean we're out of the woods, doesn't mean that we can go back to normal, but it's definitely out there. It's scary. For myself personally, I'm extremely cautious because I know what the other side looks like, and it's scary. And I know I'm young, but nowadays it doesn't matter. How do I know that I'm if I were to catch it, and working where I work at, it just puts me at a higher risk. It's scary. Yeah. It's scary, and I wish people took it as seriously as I do. I mean, even there's people in our family who don't take it seriously, and you know what though? At the end of the day, like I tell Omar and I tell anybody, I do what's best for my family, and that's all I can do. That's it. I can't. Yeah, I mean, I don't fight with other people. If you want to believe whatever you want to believe, that's fine. I'm glad that I have the experience that I have, and I use that experience to make decisions that are best for my family, and that's it.
Yeah.
Mm-hmm. I would say the same, similar. Take care of yourself. Wear your mask. Wash your hands. Don't touch your face. If you're around someone who's sick, don't move. And then check in with your loved ones on the phone, text message. Hey, are you guys okay? Do you need, especially the elderly, do you need me to pick up anything for you and drop it off at the front door? Just remember that we're all human,
Yeah. We definitely have to, I think, we don't have to love each other, but we definitely have to be a lot nicer to each other.
Yeah. Kindness goes a long way.
There's a lot of ugliness around right now, Love is something that I don't throw around, but I'm definitely nice to everybody. Unless you give me an opportunity to be an asshole to you, I'll be an asshole.
Yeah.
I think we're running close to that time where we're going to have to sign off. So if we could thank you guys again for doing this and helping me out with this and kind of just spreading it out there and giving you guys this firsthand experience and opinions on COVID with what you guys do. But what I did want to make sure that we didn't really talk about, I wanted to get into, maybe we can do this on another episode, maybe in the studio, we'll see. But I wanted to talk to you guys about your schooling, like getting to what made you guys want to join the nursing field. So all that good stuff, I wanted to touch on it. But since we don't have much time, maybe we can end with some advice to people that are thinking about joining the field, but are maybe a little discouraged because of what's going on. Maybe if you guys can give us 5 minutes at least. That's what I just got a little pop-up of 5 minutes left. But if you guys can give us some advice or tips on what to do, or what you guys did, and maybe what you guys would work on, or I don't know, whatever.
I would say do it. By the time you get through your prerequisites and get accepted into a program and then get through the program, I'm sure research studies will be out about COVID. And it's just kind of the way it is. You go through these pandemics, hopefully once a century. But it's worth it.
Irma?
Just make it good.
I would say if you're definitely thinking of going into the medical field, I think this is a great profession. You don't have to do the ICU. There's so many different options. And guess what? If you get bored of doing one thing, you can completely go in a different direction. And so I can't think of any other field where you can go from one field to a completely different one. There's so many different things you can do with nursing. Example for me, I did 12 years in the ICU. I left the ICU, and so I'm doing something completely different now. But I know that if I ever want to come back, I could do that. I can do something completely different, go back to school, be a teacher, an instructor, be a nurse practitioner. There's so many opportunities. And so it doesn't have to be that you're the nurse at the bedside. If you want to become a nurse, there's so many different opportunities. So I'd say do it. I don't regret it one bit. It was hard, but it was worth it. It's just maybe a couple years out of, the rest of your life.
Yeah. Well, so then the transition to another department it's pretty seamless. It's not as, maybe a little bit more schooling, but it's pretty good easy to move up or down.
Yeah, it really, for me, it just depends on what direction you want to go. Like if you want to change departments, that's an easy fix. You just apply to that department and they'll just train you for a few months. And that's as easy as that part gets. But let's say you want to go into like management or like a nurse practitioner, then of course you have to get your bachelor's or your master's and go that route. But it really depends. There's so many different options. I can't even touch on all of them. But there's so many options you can do. If you want to just do desk job paperwork for the rest of your nursing career, that's out there. You can work for insurance companies or, schools, businesses. So many different things.
That's awesome. All right, well, hey, you guys, thanks again. I know we're going to get cut off right now pretty soon, so I just want to appreciate what you guys do, and I want to thank you guys for coming on and keep doing your thing, man. And be safe out there, and that's it. Muchas gracias.
You.
So that's it. This is Fidel signing off here with Irma Garcia and Lorraine O'Campo.
Now tuned in to the tap in.
All right, bye.
Now tuned in to the tap in. Now tuned in to the tap in. We're talking again. Come on. Live.